Hello, my name is David Robertson. I'm the medical director of Bourn Hall Clinic in Dubai. One thing that's very important to people who are seeking fertility treatment or seeking advice about their own particular situation is getting reliable information. Now, we live in a digital age and we all have access to the internet as well as printed publications. We may have visited other doctors, but at the end of the day there is so much information out there and it's very difficult to gauge what's reliable and what's not reliable. One of the things we think is really important is to be able to provide a trusted source of information, and we feel that with our long experience and our heritage in this field that we can be that source. Of course, a lot of issues pertaining to infertility are embarrassing or difficult. People are reluctant to discuss them, particularly if it's in front of other people. So a new feature that we're going to offer is that of the webinar. Now, a webinar is a system whereby you can log on to a website and you can see me, but I can't see you, and you can ask me a question, almost like sending an instant message.
I'll be online to answer any questions that you might have.
Other people might be logged on. They can see your question and they can hear my answer. They can see any illustrations I might put up on the screen, any little videos I might want to show to illustrate the point, but they won't be aware of your identity. So people can get the information that they want, but from the privacy of their own home. For example, here's a sample question which somebody sent to me earlier, and in fact this is a very common question, where a lady has asked me whether or not she might have difficulty getting pregnant because her periods are not regular. And of course this is a very common situation here in the United Arab Emirates, particularly amongst the local population, where their periods do not come every month on a regular basis. In that situation, there may be no problem at all. It may just be a question of getting the timing right, but we can offer advice on that. Or it may be necessary to conduct some tests. And for example, we can do various hormone tests to check whether or not there is a problem there. And we can also prescribe medication to correct any problem that we might find. So in this particular situation, which causes a lot of anxiety to people, in 9 cases out of 10, there's a very straightforward solution to it.